My name is Rukelibuga. I am a Rwandan. I have lived the experience of diabetes, hypertension, and stroke. I was 57 when I had my stroke. I am the founder of Stroke Action Rwanda, and as such, an advocate of stroke survivors. I have been working for the US CDC as avian influenza specialist for 11 years. I went to retirement in 2019. My experience about stroke acute treatment is unique. My stroke occurred at home on 20 June 2016 at 4 a.m. in the morning. Within 1 hour of symptom onset, my wife managed to bring me to the nearest referral hospital, where a general practitioner gave me an intravenous drip to reduce my blood sugar and blood pressure that were alarmingly high. I was then admitted to the general ward to wait for a specialist doctor who was on night duty at another referral hospital. He arrived almost at 9 a.m. and after examining my case, recommended an MRI exam, which unfortunately turned out inconclusive. Confirmation of ischemic stroke with left side hemiplegia was obtained the next day using carotid artery ultrasonography. The physician prescribed cardioaspirin and advised continuing diabetes and hypertension medicines, which restored rapidly my vital signs. I was discharged to home after 6 days in a wheelchair. After hospital discharge, physiotherapy and talking with other stroke survivors is what got me through. From my lived experience, it is important for all countries to have national stroke action plans. Indeed, on one hand, the impact of stroke on patients, families, and society is devastating, while on the other hand, in many countries, stroke care services remain virtually inexistent. It is like countries are massively off track of prevention of stroke, the second leading cause of death and disability worldwide. In the lead up to the fourth UN high-level meeting on NCDs and promotion of mental health and well-being that will take place in September 2025, it is time to seize this opportunity to call upon countries to fulfill their commitment to tackle the burden of stroke by developing and implementing national strategic plan to change the narrative. By shedding light on the roles and the responsibilities, there's a plan will galvanize efforts to mobilize multi-sectoral collaboration, including public-private partnerships. Again, it is a priority for government to invest in stroke prevention, treatment, and rehabilitation because stroke is widely seen as a major challenge to health and sustainable development. So far, government cannot achieve SDGs without taking bold action for prevention and control of stroke. The good news is that stroke is highly preventable and treatable since 90% of stroke as well as other NCDs are linked to 10 modifiable risk factors that include hypertension, tobacco and alcohol use, physical inactivity, unhealthy diet, and air pollution. In addition, intervention in stroke has proven to be extremely efficient for the society. Each dollar spent on prevention and control of stroke and cardiovascular diseases yields a return on investment of over $10. It is also essential that to engage stroke survivors and caregivers in policy making. Engaging them ensure that interventions are people-centered, to leave no one behind, that they are evidence-based, context-driven, and deserve out of any conflict of interest. As the saying goes, no action for us without us. I thank you.